number to talk to us live in studio is 0791 478 990. Use the hashtag MyDoctor on Twitter at Ebru TV Kenya at Purity_Museo. Our topic of discussion today is your second trimester, and to help us with that discussion, help me welcome Dr. Maureen Owiti. Welcome to the show, Doc.
Thank you, Purity.
Thank you so much. We're glad that you're here.
It's always a pleasure, Purity.
Yes, we are talking about second trimester. Is it something that women should be looking forward to, the pregnant women?
Okay, for me, I think the second trimester, I would agree with you, women should look forward to it. It's the most exciting part of the pregnancy. And reason being, it's the most usually uneventful time during pregnancy, as in a few bad things happen, unless obviously a complication, but it's a relatively peaceful time during the pregnancy. So it's a time whereby the bump just is starting to show. It's starting to show, so you're fully aware you're pregnant. The movements start in the second trimester, so you really feel you're pregnant, and you now get to know there's actually somebody growing inside of you. So it's a very exciting time.
Yeah,
Yes.
and should we also start by having a look at what second trimester is in terms of the period?
Okay.
Yeah.
So the second obstetricians, we divide pregnancy into 3 parts. So the first trimester will be between the 1st to the 14th week, and this is from the last period. And we tell people last period, they'll tell us the last day. So we count from the first day of your last period in somebody who has normal cycles, that has periods every month. So we'll say, so that will be the first 14 weeks. Then the second trimester will be from 14 weeks up to 28 weeks. And the third trimester will be from 28 weeks up to delivery. So that's how we divide pregnancy. So what we're interested in currently is between the 14 and 28 weeks of pregnancy.
The second trimester.
Yes.
And when we were discussing about the first trimester, we still had you in studio, and there were so many symptoms that you really talked about for the first trimester, cravings and all that. So for the second trimester, do we look forward to having all that leaving that behind the first trimester, or do we carry forward with those similar symptoms?
Okay. So as I've said, it's a time whereby things are good. So in majority of women, more than 90%, all these nausea, vomiting, smells, diarrhea, constipation, okay, those may continue, but at least the nausea, vomiting of pregnancy, in more than 90% of women would go away. There are some few people, unfortunately, they can have it the entire pregnancy. But for most women, they should look forward to at least nausea, vomiting out the window. And you can do stuff, you can eat finally, and things become good. Yes.
Yeah. So do we also have some symptoms for the second trimester?
So as I've said, what we're looking forward to in the second trimester is the bump begins to show. And especially like at 20 weeks, you can actually see that there is a definite enlargement in the lower part of the abdomen. And then at between 14 to 20 weeks, so that's the 14 to 18 in women who have delivered before, and then 18 to say 22 weeks in first-time mothers, the baby starts to move. So we're looking forward to, can we feel the baby moving? And I think that's a very exciting part, especially for first-time moms, to actually notice the first movements of the baby. The only unusual thing is in the second trimester, naturally, the blood pressure goes down. So the common symptom, which I think was where you're trying to go, would be they have a lot of headaches, and fainting spells. And this is just because naturally during that period the pressure is much lower than at any other time during the pregnancy. But the relief for that is just to make sure that we hydrate well. So you drink a lot of water, and the ideal amount is about 2.5 to 3 liters of fluid on a daily basis. And you'll find the headaches and the fainting spells will not be so severe. Yeah.
And talk to us, our topic of discussion today is your second trimester. Feel free to even share with us your experience with your second trimester, or even ask a few questions if you are really on your second trimester, or you want to learn, you're preparing to getting pregnant, you want to learn more what happens during the second trimester, use the number 0791478990. And Doc, I'll also ask you about the second trimester. You said it's an exciting moment that women should look forward to, but is there a need to prepare for the second trimester?
Okay, in terms of specifically preparing for the second trimester, it would be any preparation like for the pregnancy itself. So for me, it would be, if you've already started attending clinic, would be just continue doing your clinics as we look out for the danger signs during the pregnancy, and that's the need for the clinic. We're currently recommending that women during the entire pregnancy should go to clinic at least 8 times. And you'll find, so during the second trimester, it would mean you need to go to the clinic about, say, 2 to 3 times during that particular period at a minimum. So it would just be emphasis that you continue what we've been doing in the first trimester, whereby healthy lifestyle, walking, eating a healthy, balanced diet, and hydrating well, but still attending your clinics to just make sure that danger signs are picked up early and any complications managed in a timely manner.
Yeah, and just in case you're joining us for the very first time, our topic of discussion today on the show is your second trimester. Dr. Maureen Owit is helping us understand some of the, how we should be looking forward to really having or preparing ourselves for the second trimester. We'll be having a look at some of the red flags or symptoms for the second trimester, as well as looking at how some of the body changes there are for any pregnancy once it gets to the second trimester. Use the number 0791478990 on Twitter. Feel free to use the hashtag #MyDoctor at Ebru TV Kenya at Purity_Museo. And Doc are still staying with the symptoms that you've talked. Let's have a look at the red flag symptoms, the unusual symptoms that once any woman during the second trimester, you still have them persist. They could be symptoms from the first trimester, then it's a cause for alarm.
Okay. As I've said, some people may have the nausea and vomiting continue, but in terms of our danger signs, I think the most obvious are things like bleeding. Bleeding throughout pregnancy, anytime during the pregnancy, definitely is not good. And I think most people, if they know they're pregnant and they bleed, would automatically at least seek some form of help from a healthcare provider. The other thing, we have amniotic fluid. So if you find if the amniotic fluid of the baby comes out, so that's what we call the drainage of the LICA, or the rupture of the membranes, definitely at this point in the pregnancy, that's a very, very, very big red flag and can have very severe implications on the course of the pregnancy. And unfortunately, if we drain so early, we are most likely to lose the pregnancy, but there are some few people who have managed to go on and to have a successful pregnancy. Other issue is all these complications like high blood pressure of the pregnancy, they can actually manifest.
Doc, we have Carol is online before we get to the complications.
No problem.
Hello, Carol.
I'm Carol. I had a question with the doctor. Yes, when I've gotten pregnant for 2 times. I'm fine. I have gotten pregnant for 2 times.
All right.
But when it comes to the second, and it comes to the first month, I do miscarriage. I don't know what could be happening with my body. So I could ask the doctor to assist you.
Okay, let's respond to her first.
First, I'd like to say Polisana to Carol for her loss. And she sounds like she said she has had 2 losses, if I got her correctly. I'm not very sure that they occurred in the first or the second trimester, but she's somebody, if she's had 2 losses, we just advise her to see a gynecologist who can do a thorough evaluation, because I think we discussed pregnancy loss and the reasons are quite a number. So she need a thorough evaluation to find out what's the cause of a pregnancy loss. Now, when we talk about second trimester specifically. So for her, she sounds like she was having a first trimester loss because she does the ultrasound and she's told the pregnancy is not continuing. So for her, just advise a thorough evaluation of the gynecologist to try to help her narrow down on what can be done to have a successful pregnancy. But if we speak now specifically for second trimester, common reasons for loss of pregnancy is one, usually it's some form of cervical or uterine abnormality. So cervical, you'll find that the cervix sometimes is loose, or what we call an incompetent cervix, and or cervical insufficiency. So for such women, and they usually lose the baby between 4 to 7 months of the pregnancy. Such a women we can easily help. We normally put a MAC stitch, a McDonald stitch, to tighten the cervix and help the pregnancy continue. We have other women who have uterine abnormalities, so common things are like fibroids, and then we have congenital abnormalities that the shape of the uterus is not correct. So you'll find somebody with fibroids. The ideal thing would be if she's miscarrying and we think the cause of the miscarriage is because of the fibroids, maybe before she embarks on a subsequent pregnancy, to consider removing the fibroids. And those we think that the uterus is having an abnormal shape, probably they can consider having some form of corrective surgery to remove that abnormality and increase the chances of a normal pregnancy. So as I've said, she needs an evaluation so that we can assist her.
I think we can just continue with that topic on some of the complications as we have a look at some more red flag symptoms.
Okay, so I think we've mentioned bleeding and the water coming out. So another common, again, women get a lot of urinary tract infections, but you can get severe infections that will result in, say, having a fever. Anytime you have a fever, that is not a good sign, and especially if the water has drained, it means that we're now having an infection of the lining of the uterus, and both for the baby and the mother, that can be quite catastrophic. We also have issues of movements, but we'll say unless somebody is actually in the third trimester, as long as they're perceiving movements now and then, it's good to be keen. Beyond 28 weeks, it's good to know how the baby is playing. You're having a concern, there's no harm in getting checked. So again, that would be a danger sign because you're carrying the pregnancy to have a live baby. And sometimes a reduction or absence of movement can indicate that there's something wrong with the baby. Other things, very, very severe, is obviously by the time you're starting to have impaired vision, that you're seeing clouds, you can't see properly, any severe abdominal pain, especially in this upper area, like somebody who has ulcers, or even convulsions or fits, like somebody who has epilepsy. Now that you have eclampsia, that's very severe cases because of hypertension. And this, in as much as second trimester, we don't really expect a lot of it, but we have some women who have the hypertension because of pregnancy that manifests quite early, and we're seeing quite a number of cases quite early, and it's during the second trimester. So those are the things that we tend to look for generally, and then also just screen for any other medical conditions. So common things would be things like diabetes that can be managed adequately, and this actually right from the onset and even pre-pregnancy. I'm trying to get women away from just reporting to the doctor when they're already pregnant. Those who are considering having a baby, we are actually encouraging them to actually go for a pre-pregnancy consultation. So a lot of these issues can be ironed out before the pregnancy.
And they can be prevented if a woman, as you say, they go for the pre-conception, maybe consultation. That's what you're saying. And Doc, the complications that you're talking about.
Okay, some things may not necessarily prevent, but at least manage to minimize any adverse effect that it's going to have on the pregnancy. Because diabetes, if you have it, it's a lifelong disease. So the idea would be to manage your sugars so that both you, subsequently after the pregnancy, you're well, and the pregnancy is going to progress well.
And the complications that you're talking about, are they the possible complications that a mother may develop during the second trimester? Do we have more?
Okay, so definitely those are the most common complications that women can develop during the second trimester. But we have so many things, but they're not so common, and we don't routinely screen for them, but should they occur, so like we have the intrahepatic cystitis of pregnancy. It's something that would affect a problem with the liver, or even acute fatty liver of pregnancy. So there are a number of complications, both medical and obstetric, but from obstetric, second trimester, the things we're usually worried about are bleeding and the drainage of the amniotic fluid, reduction of the fetal movements and things like that.
Yeah. And so, Doc, what's the antenatal care for positive pregnancy like during the second trimester?
During the second trimester. So again, for us at every visit, we're going to evaluate how your blood pressure is. Ideally, we should also evaluate a urine sample. Some people also actually check blood sugars, but at least at every visit, a blood pressure has to be taken, and we're going to monitor the growth. How is the baby growing in the abdomen? And this will give us a very good indication. We're also going to take history from you. That are you bleeding? Are you having pain? Oh, I forgot to mention also, severe abdominal pain would also be a danger sign during the second trimester. So are you having pain? Are you having any issues that would warrant a further investigation from the routine? So if we find somebody is normal, we'll always just monitor their basic vital signs and how the baby is growing. At first visit, first contact, we do what is called an antenatal profile. So again, this is Kenya, and you find a lot of women will report for the first time in the second trimester.
Right.
So at that time, we do what is called an antenatal profile. So in this antenatal profile, we're going to check your blood group, we're going to check your blood levels, and whether you have HIV, whether you have syphilis, hepatitis, and screen for urine infections, and screen your sugar to just rule out some of those. So those are the common things that will be done. Now, when we talk to you and we find you have other issues, we're now, say for example, maybe you have a thyroid problem, we're now going to see how is your thyroid behaving during the pregnancy, because what medication were you taking? Is that medication safe for the pregnancy? Do we switch? And fortunately, most medications, we may not necessarily need to terminate the pregnancy, but definitely at earliest onset, we're going to switch to drugs that are safer during the pregnancy. So especially for people who know they have a medical condition, you're somebody who has a heart condition, you're somebody who has a thyroid problem. These are people who we wouldn't say don't get pregnant, but have an evaluation so that your medication is switched to that which is safe during the pregnancy.
And you've talked about checking in late to a clinic late, especially during the second trimester for the antenatal care. Is it a risk factor to some of the complications that you're talking about? And what are other risk factors for failure or late antenatal care?
Okay, so definitely for us, especially those who have medical conditions, not being controlled prior or as early as possible during the pregnancy is definitely going to have an impact on the pregnancy. Now, if I talk of obstetric complications like bleeding, I cannot tell which person is going to bleed or not bleed. Having had said that, somebody with high blood pressure has a higher chance of bleeding than somebody who does not have high blood pressure. So unfortunately, why we will tell people is just to counsel them on what danger signs to expect and when to report to a hospital as soon as possible, because if you look at most of the danger signs I've mentioned, there's very little we can do to prevent. So it's how soon can you report if you're aware that this is a problem, like the baby, you've not had the baby playing for a day. Instead of waiting for 3 days when we've lost the baby, could you come earlier? We do something to prevent you losing the baby before you've actually lost the pregnancy.
Yeah, and also now, Doc, prepare us for the second trimester. Other than having the belly grow larger, of course, during the second trimester, what are some of other body changes that we expect during the second trimester?
Okay, as I've said, second trimester, for me, even I always make fun with my clients. That there's a time, all those things you want to do. You want to decide on a hospital, you want to buy baby clothes, you want to do whatever. This is a good time to do all that stuff because you're just almost your pre-pregnancy self, only you have confirmed that you're pregnant. But some people can have like lower limb swelling in terms of the edema of the lower limbs. And as I've said, the common thing that is not pathological would be the fainting spells and the headaches. Other than that, you're actually normal, you're well. So this is the time I encourage, start walk or do some form of exercise and stuff like that, because you're well. Just do whatever it is. Third trimester, we go back to a shift. Things start becoming very difficult. You can't breathe, you can't walk, you can't sleep, you can't do anything during that. So second trimester for me is the most exciting part, because you just know you're pregnant. That's the difference.
Right,
Yes.
and the belly is growing larger at this time,
Yes.
so there is some confusion, especially for the first-time mothers, especially in regard to the sleeping postures. How do you go about it?
That's an awesome question, Purity. So again, because of the physiology of the pregnancy, now the uterus, what happens is, by its position, it actually lies on your major vessels. So that is the aorta and the inferior vena cava. And actually what we're interested in is the inferior vena cava. So you find return back to your heart is not as good as somebody who is not pregnant. So because of that, we actually like to recommend that women should sleep on their side. You shouldn't sleep lying on your back. Early second trimester, you can get away with it, but late you find it's easier and better for you to sleep on your side. And that's the position we recommend pregnant women to get used to. So we prefer the left side, because you find that we now relieve the pressure of the uterus on the vessels. But they can also sleep on the right side, and to avoid sleeping lying on their backs. To aid this, I think people have this, I don't know, I can't remember the name of that pillow, but it's that long, round pillow, and you can curve yourself around it. It's quite fun. If you don't have, I'm hoping that you have a partner. They can act as the pillow.
Oh, no.
Yes.
Okay, Doc, and also we do have, when you come back, of course, we'll be talking about the changes with the baby, what happens with the baby, and also knowing the sex of the baby. But before then, Doc, how do you go about the prenatal depression? It's a whole topic of discussion, but some advice for the do's and don'ts during the second trimester?
Okay, so in terms of depression during pregnancy, fortunately, I think due to the hormonal changes, unless somebody had some underlying problem prior and is already on management. So do's would be, if you're on treatment, definitely, again, is your treatment safe in pregnancy? Have your medication been adjusted to those that are safe in pregnancy? So again, that would be another condition that should have been sorted out prior to pregnancy. For us, we look at it usually during the postpartum, because of the extreme shift of the hormones following delivery, that we get the postnatal depression, and that can be like new onset, but depression can occur at any time. So do's, unfortunately, a lot of these psychological, let's just say, instability, a lot of it also has to do with an emotional stress. It's your social surroundings. So it would be really to just try to associate yourself with people that make you have a positive experience and feeling about yourself.
Okay.
So it's not something very easy to do, because you can't necessarily control, like say you don't have any control of who your family is going to be, but you can control who your friends are going to be. So relate with people who are giving you a positive experience.
Okay, and when we come back, this discussion still continues, but we will be focusing our discussion on what happens with the baby during the second trimester, knowing the sex of the baby, and also how to stay active during the second trimester. Do stay with us. Welcome back to the show. My name is Purity Museo and you're watching My Doctor Show. Our topic of discussion today is your second trimester. And to help us with the discussion in studio, we have Dr. Maureen Owiti. Doc, welcome back to the second part of the show.
Okay, thank you, Purity.
Yes, and maybe before we get to the baby, what happens with the baby, you could now help us understand how to stay active during the second trimester. What is the exercise like for the second trimester?
Okay, so one, during the entire pregnancy, we're currently recommending that women should be as active as possible. Of course, with reason. Definitely if you're having a threatened miscarriage, probably we don't need to be so active. So what we recommend is that if you're already doing some activities, you may continue with them. But if you are not doing anything, we don't recommend that you now start gymming because you're pregnant and you want to stay active. So what can people easily do that's safe and they're already doing? Walking. So we all walk. So probably maybe like a brisk walk, 30 minutes. And when we say a brisk walk, we always mean it should be something that if I'm walking with you, we're walking together, both of us are finding it's a strain for us to talk to each other. That would be a brisk walk. Okay? 30 minutes every day. That's easy to do, and it's something you already do. For those who are already doing more intense exercise, they can continue. Swimming. Swimming has very little. It's a fantastic sport, but I think the challenge with swimming is again cost. That not everyone may be able to access a swimming pool, and again, some of our freshwater bodies they do carry some disease, so we would not necessarily recommend that they go to freshwater bodies. However, if they're able to swim in the ocean, those who live nearby the sea and they feel comfortable, it's fantastic. It's a fantastic exercise. So basically, things that you've been doing prior to the pregnancy, if you feel comfortable and there's no problem with the pregnancy, you can continue. So those who are gymming, you can continue, but you find second trimester they should still be able. It's just they modify the exercises so that the intensity is not so high. We can't do the high impact exercises. So if you talk to your gym instructor, they'll be able to advise you on what is safe for you that you're pregnant. But something that is an exercise that everyone can do would be walking. Walking.
And Doc, there is also another concern, doing a strenuous job. Maybe you're doing a really heavy job or even activity. Can it affect the baby? Can it be a reason or a cause for miscarriage and also affect your delivery? Okay. If you stay inactive, will it affect your delivery? If you do strenuous jobs or activity, can it as well affect the baby?
Okay. So for me, inactive, let's start, because that one for me is easier. You find that people who are less active are more prone to getting clots. And clots can be in the legs and more dangerously in the lungs. The legs, you get a lot of pain, but the moment you get clots, it's a risk of them going to lungs. And the moment a clot goes to your lungs, that's a life-threatening situation. Even I think you've seen that a lot of women have had normal pregnancies. They go deliver, whether CS or normal, go home 2 to 3 days later, you hear they're sick, and we've lost some women. And that partly is due to inactivity, partly. There are other risk factors you find again. It'll run in families that some people have, they're more prone to getting clots than others.
Okay.
So about heavy, okay, no problem.
We have a caller, can pick the call first. All right, hello.
Hello.
Hi.
Hi, my name is Nyatichi. I have a question for the good doctor.
Okay, go ahead.
I'm in my second trimester.
Right.
Hello?
Yes, go ahead.
I'm saying I'm in my second trimester, but I find that it's either milk or water that is coming from my bust. It's a lot, so I don't know whether it's good or it's a bad thing.
Doc, you can respond.
Thank you, Natichi, for your question. So what I'd ask would be, is if it's coming out by itself. It can happen that women start secreting milk from the breast prior to the pregnancy. Usually it should not be a cause for alarm. I'll just advise her, if it comes out, if she presses the nipple, to just refrain from trying to press the nipple and see if there's anything coming out of it. That's natural. If it's coming out on its own, I'll just advise her to just look at things like her bras to get a good support for her breasts. In rare instances, it can be a cause for alarm, but basically it's just monitor how the baby is playing. It should not be a big issue.
Okay. Let's get back to the inactivity during the second trimester.
So I think we talked about the inactivity. We're going now to the opposite, that if somebody has strenuous job, lifting heavy things, if it's something they've been doing and they don't stop, we're actually advising women to do their normal activity for as long as they feel they're able to comfortably do it. But if you find that she's now feeling like it's strenuous for her to do, we do have a provision to recommend that probably she's given some lighter, less strenuous work to do. In terms of it affecting the baby, it really would depend, but anything that has a lot of, say, vibrations can have an effect on the pregnancy. Yes.
And now let's get to what to eat during the second trimester, especially during actually pregnancy. Is there a specific concern? Should we put more emphasis on our diet during the second trimester, or should it be a lifestyle during the pregnancy period?
Okay. For me, what to eat is basically what you'd eat when you're not pregnant. So we're always advocating that, regardless, always promoting a healthy lifestyle. So for me, I'd be like the first myth is always, I think eat for
the baby.
For two. So that's what you're told, eat for two. Now, for me, personally, I don't subscribe to that particular mantra of eating for two. Because you find, I'm somebody who would like women to have a natural birth, okay? And as long as both her and the baby are not having any issues, and pregnancy and labor progressing well, we're aiming for a natural birth. So when people are told eat for two, most people love starch, and that's the carbohydrates. That's the chips, bananas, potatoes, rice, and you're eating for two. Now you find carbohydrates are metabolized very fast, and when you eat for two, the weight will go to the two of you, not just the one person. So if you have a large baby, we're actually we're minimizing the risks of a normal pregnancy. Because obviously if your baby is 5 kilos, your risk for cesarean section, you're more likely to have a cesarean section than a natural birth. So for me, it would be, the difference is because of some of the changes, you find maybe you're bloated or you have acidity and stuff like that. So what we advise is that we eat frequently, but small meals. What to eat? Obviously, balanced diet. Always we advocate that you're going to eat a lot of vegetables. You still need carbohydrates and you still need protein, but just balance that the diet is balanced. And not forgetting about fruits, so you can snack fruits, you can alternate with vegetables and stuff like that, and drink a lot of water. So it's just your normal, natural, healthy balance. So the difference would be to avoid the bloating and constipation and stuff like that. So instead of eating one heavy meal, maybe that's what you're used to, it would be to have many small meals. So you just eat all the time, but small portions.
Yeah, and you've talked about eating for two, because many people don't want to have a really small baby. But again, the issue of weight gain during pregnancy, how do you address it? Is it through what you're saying, like just eating small portions but regularly? So just tell us how regularly it should be so that you avoid getting a larger baby, and at the same time you do not want to get a very small baby at the same time.
Okay, so in terms of how often, it would be like you'll have maybe 5 to 6 meals, or every like 3-4 hours, just have something to bite. Now, in terms of weight gain, a healthy weight gain during pregnancy will be 1 to 2 kilos on a monthly basis. The moment you're doing more than that, you're gaining more than what you need. And as I've said,
says there's another caller online. Hello.
Hi, how are you?
Hi.
My name is Hannah.
Just
Hello.
reduce the volume of your TV.
Okay, look, yeah, hi.
Okay, go ahead.
My name is Hannah. I have 2 questions where I'm in my 3rd trimester.
Okay, go ahead.
So my first question is about taking water. Can I take, sometimes water is tasteless, yeah? So is it okay for me to take milk and sodas, just to hydrate myself?
Okay.
And my second question is, every time my bowels are full and I feel like passing out stool, my blood pressure goes up. And nikienda choo, I get back to normal. So how is it interconnected?
Okay.
Thank you.
Did you get the first question?
I
think
didn't
I did.
quite
She doesn't
get.
like water.
She doesn't like water. She wanted
milk
to use
and soda.
Milk and soda.
Yeah.
Okay, fine. So a lot of people, for some strange reason, don't like water. Plain water. So if you look at her options, would be milk, soda. Soda, maybe a glass occasionally. I will not say don't take soda, but you find amount of sugar put in soda, you're getting so much sugar that is going to cause you some unnecessary weight gain. She can't stand the taste of water. She can try flavoring the water. Maybe she put a slice of lemon. Okay, I think it's a new fashion nowadays. Even you go to the supermarket, you have strawberry water, lemon water, melon water. So maybe like they say you infuse with fruits. It gives it a different dimension without necessarily adding the calories. The beauty about water has 0 calories. Okay, so you will not add weight from the amount of water you take. But if you're going to take, I've advised that in terms of fluid, your fluid intake should be about 2.5-3 liters. Can you imagine taking 3 liters of soda every day? What is going to happen? It's not a very good situation. So we'd just look at ingenious methods. Can she take tea? So like black tea, milk, she can have a glass or 2 or even 3 glasses of milk, but I would not advise that she takes 3 liters of milk, because again, milk contains a lot of proteins, it contains a lot of carbohydrates. So definitely I'm not going to advise to take 3 liters of milk. So it would be to look at, can she have juice, like freshly squeezed juice, freshly squeezed orange juice? It'll be definitely quite expensive considering how much fruits cost nowadays. But just look at ingenious methods of how she can increase her fluid intake without necessarily increasing her calorie intake with the fluids that she's taking.
Yeah, and just before you answer the second question, someone else is calling from Githurai. Hello.
Hello.
Hi.
Hi.
Talk to us.
Okay, I wanted to ask, I'm 16 weeks pregnant and I've been bleeding. I've gone to the hospital. Now they told me I need to be done a second scan to see if the pregnancy is viable. Yeah. Is it fine for me to be done the scan the second time?
Okay, I think her question was that 16 weeks and to see if the pregnancy is viable. Scans are generally safe and you can do multiple scans. all we are just advising is to really just visualize how the heart is beating. We have modalities that we see to measure the heart rate. That should be done for a short interval. But in terms of just doing a scan and visualizing the baby, that can be done quite safely multiple times during the pregnancy. So she should go ahead to find out about the viability of the baby. I think probably the reason was that at 16 weeks, other than doing a scan, especially if she's her first pregnancy, she has not yet started perceiving movements. So other than doing a scan, we cannot really tell, or using what is called a Doppler, we cannot really tell if the baby is alive or not. So it's just confirming, and she should safely do it. Now, if we go back to the other caller, I think her second question was about
blood pressure and stool.
Stool and blood pressure. I don't know how she's measuring her blood pressure every time she's going for a long call. But if you strain, definitely, even just standing, sitting, they're the normal fluctuations in pressure. So I'd really have to find out what figures are we talking about. Are they actually something to warrant more attention? But anytime we have elevated blood pressure, and the figures I'm talking about, the upper one, which we call the systolic, should be above 140, and the lower one, which we call the diastolic blood pressure, is 90. So systolic is when the heart is contracting, and diastolic is when the heart is relaxing. So we have different pressures during those phases of when the heart is beating. So if we have anyone with a blood pressure greater than 140 over 90 millimeters of mercury, definitely it would require some further attention. So I'm not sure the figures she's talking about and exactly what's happening, but even just standing would cause a change in your blood pressure. These are things that can happen. So,
all right.
Yeah.
And now let's see what happens to the baby during the second trimester, the size, some of the changes with the baby. Take us through that.
Okay. So again, as I've said, second trimester is just a very awesome time. So if you look at this baby, first trimester started from a single cell that it's just one cell and it's all the same, just a round thing. And it has differentiated to get the structures that were forming the heart, skin, brain. So what is different in the second trimester is that majority of organs have actually developed. They're there. You have eyes, head, nose. Even you can see from the video they were showing when there's a point where the eyebrows appear. So it's a being. It's actually a being. It's a human being with everything. The only difference in the second trimester is these organs are not yet mature enough to perform the functions the way they need to be once the baby comes out. So during the second trimester, it's maturation of those organs so that by the time the baby comes out, the organs are able to perform their functions as needed. So it's more accelerated growth. The baby grows faster in terms of the number of cells during the first trimester, but now in terms of weight, you'll find that maybe at 20 weeks, this baby is like half a kilo. So that's that blue band box that's already. And by the time we're at 28 weeks, when we're ending the pregnancy, this baby is weighing a kilo. So again, sometimes we sound like sadists, but we're not. Also understanding that before 20 weeks of pregnancy, like the second caller said about if the pregnancy is viable, okay? So for us, viable would be that the baby is alive. I think both the trainers are alive, but a baby that is less than 20 weeks, so that's the first part of the second trimester, cannot survive without the support of the mother outside of the pregnancy. So that's when we consider viability, after 20 weeks of pregnancy. But even 20 to 28 weeks, so that's the second part of the pregnancy, in as much as we've said that the pregnancy is viable, that i.e. it can survive outside of the mother's womb, It's still immature, and chances of survival are also quite low. Beyond 20 weeks, there's still risks, but this is a baby, now that's in the 3rd trimester, that if born with good neonatal services, the chances of survival are a bit higher. It's still touch and go, but that's what's happening. So in 2nd trimester, it's more of the organs, your liver is developing to be able to work on its own. Yeah, because most of the functions are being performed by the mother by virtue of an organ called the placenta.
Yeah. And Doc, you saying that during the 2nd trimester, the organs are now developing, but they are still immature.
Yes.
Let's get to the issue of the birth defects. Is it the time that we get to know when, for example, a mother goes for a scan, is this the time they get to know that, you know what, I think there is a problem with the baby?
Okay, so again, you're very correct. So birth defects, we look at them at various points in the pregnancy. Not very common here, but I think as we're getting to be more litigious, so you'll find doctors will be more cautious on how we do. So we already start looking for defects from 1st trimester, whereby we have markers in the blood and on ultrasound that we look for that can indicate your baby may have some abnormalities. But in terms of structural, on ultrasound, we are able to visualize some abnormalities, and this is normally done between 18 weeks of pregnancy and 28, so right bang there in the 2nd trimester. But the earlier you do, the better. But again, it raises some ethical questions because we're in a country whereby we have, I think, 3 groups of people. There are those who, for example, they see the baby has a birth defect, and do they consider terminating the pregnancy because of the defect? And that would be the reason for doing the scan. And there's some people that regardless of the birth defect, they don't mind, they're going to want to continue because they don't believe in the issue of termination of a pregnancy. And there are those who are watermelon, wakoko katikati. They're just they don't have very strong emotions on either side. But if you look at it, if you're going to do an anomaly scan and you find some abnormality, one would be to prepare the mother that possibly this child is going to have some issues, and so psychologically, and also as a team. So let me give an example of a common birth defect. We have something called, say, spina bifida. So this is an abnormality with the development of the nervous system of the baby, and it presents with a hole in the spine of the baby and can be associated with weakness of the lower limbs, and also the baby not able to keep urine properly. So we can easily see that on scan, and this is a correctable defect, but it needs to be sorted out as soon as possible. So it would be for us as the team to prepare so that we get on board pediatricians, we get on board pediatric surgeons, so that these defects are dealt with as soon as possible from delivery. It also helps to decide on what is the mode of delivery for these infants. So we do them. But as I've said, people are different. Some countries, they will offer a woman termination if they feel she does not want to continue with that. But as I've said, it's an ethical thing. It's something, it depends on the client and the doctor.
So what are some of the birth defects that could be acquired during this 2nd trimester when the organs are developing? And do we have some risk factors or contributing factors to that?
So again, it's also understanding these defects have been developing through the course of the pregnancy if they're going to be what you consider a congenital abnormality. It's just in the 2nd trimester, by virtue of the size of the baby, you may be able to visualize some of these defects. So again, I'm going to be very clear. What we're seeing on ultrasound will be as structural. So do we have 2 eyes? Do we have 10 fingers? Do we have a complete spine without a hole? Is the brain normal on how we see it. It cannot be able to tell us if the baby has, say, diabetes. We cannot see that on ultrasound. So what we're looking at are abnormalities, but these abnormalities, if they're congenital, most of the time it's something that has been developing, but we're not able to visualize earlier in the pregnancy, but we're able to visualize during the second trimester. In terms of, are there defects that can develop around this time? I can give you some examples, medications taken around this time. So I mentioned something about patients with heart.
And just before you continue with the defects,
Yes.
Doc, we do have Ruth from Eldoret. You
Yes.
can pick her call. Hello, Ruth.
Nasema niko 11 weeks pregnant,
Okay.
but hapa kwa tummy yangu chini huwa nasikia uchungu, pain kali sana. Alafu inafika mahali nakojea mkojo ni strong tu, lakini ile dark.
Do you have a follow-up question before you let her
No,
go?
I think she has a very typical thing.
Unaweza mjibu kwa Kiswahili.
Naweza jibu kwa Kiswahili. So alikuwa naitwa
Ruth.
Ruth, eh?
Yes.
So Ruth, unasikia kama uko na infection ya mkojo, so ingekuwa mzuri sana ungekuwa hospitali, upimwe mkojo, upewe dawa, utasikia vizuri.
Yeah, okay.
Okay.
Thank you.
So, like what I was saying, so you find a lot of people with heart conditions are on a certain medication, warfarin. Now, warfarin, if taken in the second trimester, is going to have some impact on how bones are developing in the baby. So you find that when they're born, they'll be born with some special facial features on the face, and it will be as a result of taking that medication. So which is why I said that especially if you have a pre-existing condition, it's very good that you see your healthcare provider as early as possible so that your medications are modified to those which are not going to have an impact on the pregnancy. Okay? So that's just one example, and there are several, but that's what came immediately to mind.
Yeah, and just to make it simpler for our viewers, for people who are preparing to get pregnant, for people who are ushering or getting into their second trimester, and for people already in the second trimester, what are the do's, in simple terms, the do's and the don'ts during the second trimester?
For me, the do's is just make sure you go for your clinics, nothing else, and enjoy being pregnant. It's, as I've said, it's the funnest time of the pregnancy. Your nausea has stopped or is about to stop, and all is well. And should you experience any danger signs that we talk about, immediately go see your healthcare provider. Otherwise, just be you and enjoy and have fun being pregnant.
Okay,
Yes.
the don'ts.
The don'ts. Now, in terms of don'ts would be to look at occupational hazards. So we've said, like for example, I'm a doctor, but I'm not a radiologist. But you find like radiologists, they work with radiation. So I think it would be to inform your superiors earlier so that probably you're given work, because not all work for radiologists involves dealing with radiation. Smoking, alcohol, drugs, all those things are things that definitely will be a big no. Stop smoking, stop taking alcohol, stop doing drugs.
They will not only affect the mother, but
Yes.
also the baby as well, right?
Both of you, yes. We have babies born with alcohol syndrome. There are babies who are born with withdrawal symptoms when they are born because the mother is taking drugs. And these are real issues and really coming up in society. And it's getting, unfortunately, it's getting worse as times go by. I think for us, when we were growing up, it was still an issue, but not as big an issue as it is currently. Then also, try not to be adventurous with new things, because you know what works for you. So don't start. So like I think if you look at people in the West, they'll start telling you don't take chocolate, don't take nuts, because baby can be born with allergies and all those things. So something you've not been taking, especially like food and stuff, prior to pregnancy, probably a good idea. Don't experiment at this point in time. But my big don'ts would be obviously the obvious: smoking, alcohol, and drugs. Yeah.
And I think that's all the time we had for the show today. Dr. Maureen Owiti, thank you so much. It's always a pleasure to have you here with us on the show. We do appreciate it.
Yes.
Yeah, and that's all the time we had. Yes, thank you so much for keeping us company. Thank you for watching the show. My name is Purity Museo. Of course, the show continues next week, Monday, Tuesday, and Wednesday, same place, same time. Bye-bye for now, but I leave you with the home remedies.